Guys, today we're talking about word roots. So, when you are looking for the meaning of a medical term, look to the word root because that's the foundation of the term. That's where everything kind of starts, and that's where you should really be looking. A lot of times, the word root will give you things like where you're talking about in the body system or the part, or what action is being taken in the body. So, if we look at the term gastroenteritis, gastroenteritis actually has more than one word root. So if we look at this word, you can see down here on the corner of the screen where my iPad is, you can look and see that gastroenteritis. This medical term has gastro, which is a word root, and enter, which is a word root, and then itis, which is a suffix. So let's break down this word. So if we look at gastro, and then enter, and then we got itis. We've talked about itis before. So itis means inflammation. Enter means intestine, specifically your small intestine, and gastro means your stomach. So that means an inflammation of your stomach and your small intestine. So, but you can see, just like we were talking about, that it has more than one word root, and that is okay. You can definitely do that. Let me switch back to my face. And it's also possible for you to have a medical term that's built without a word root. It is possible for you to have a medical term that only has a prefix and a suffix jammed together, okay? Like the word hypertrophy. Hyper means too much. Trophy means development or nourishment. So hypertrophy means excessive development. So that is definitely a word that doesn't have a word root. So sometimes that is possible, although when you have a word root, you should always look to the word root first. Now, combining vowels exist as the verbal glue that hold our pieces together. So it makes it possible to pronounce really, really long terms. And usually our combining vowels are O's. And they're combining either two word roots together, like we had gastroenteritis, or a word root and a suffix together, okay? So here's a couple rules for when we're using combining vowels and when we don't, because as you've seen, a couple of the words that we've talked about in class, you don't use combining vowels, okay? So, in between the word root and the suffix, if the suffix starts with a vowel, a combining vowel is not necessary. So if you see the word arthritis on your screen, arthritis is an inflammation of your joints. It's not arthritis. That extra O in there looks weird, and it doesn't really seem like it vibes with that word, okay? However, if the suffix begins with a consonant, then you definitely need to use a combining vowel, okay? So if you were to look inside of your joints to see what's going on when you have arthritis, you might use an arthroscope. You would have to put the O in there, because if you just said arthroscope and didn't have the O, that word doesn't even really make sense. And there's 1, 2, 3, 4, 5, 6 consonants in a row. That word doesn't really work. You have to make sure that you have a few vowels in there to make that word pronounceable. Now, in between word roots, it doesn't really matter. You typically keep the combining vowel. So if you're sticking two word roots together, you typically keep the combining vowel, okay? Even if that second word root starts with a vowel. So when we did gastroenteritis earlier, you see gastro and then enter, okay? So you see in this particular word that enter starts with an E, which is a vowel, but you still have the O. But gastroenteritis, the suffix starts with a vowel, so you didn't have to go gastroenteroitis. That's just too much, okay? So when you're writing word roots, typically we write them in the combining form format so that we can have the word roots and their combining letter stuck together. So examples that we've already talked about are cardio, arthro, and gastro. We typically write them with the slash combining vowel so we know what's together. Now, here's a couple of slides, and we're going to talk about some common combining forms that you're going to see over and over again. I'm going to roll through these quickly. Feel free to pause the video, and if you got questions, ask me in the comments. So, adeno means gland. Carcino is cancer, so if you had like a carcinogen, that is a cancer-causing agent, because we talked the other day about gen, G-E-N, means formation or creation of. So carcinogen is something that it creates cancer. Cardio is heart. Chemo is chemical. So if you were thinking like somebody who has cancer, they were exposed to a carcinogen potentially, then they have to go to chemotherapy, which is chemical treatment for your cancer. They're pumping your body full of chemicals to help kill the cancer. Cysto means to cut. Dermato means the skin, like a dermatologist is one who studies the skin. Entero, we talked about that one. Gastro, we've also talked about that one. Gyneco means female, excuse me, means female. And if you have been to a gynecologist, you have gone to a female reproductive system doctor. Hemato means blood, like a hematologist is one who studies the blood. Or a hematoma, you don't know the suffix OMA yet, but OMA means a mass. So a hematoma is a mass of blood. We call that just a bruise. Hydro means water. Immuno means immune. So if you were immunocompromised, an immunocompromised person is somebody whose immune system is not working. It's a little compromised. It doesn't function correctly. And you see that with a lot of cancer patients and things like that. Their immune system is not working at 100%. Laryngo is your voice box. So if you had a laryngoscopy, that is a scope that they put up your nose, down your throat, into your voice box, and they actually look up and they look at your voice box and see how the vocal cords are moving to see if everything is going correctly and see if you have good vocal cord structure. Morpho is shape. So if you see something that is amorphous, that means it is without shape. So the A prefix means without. So without shape. Nephro is kidney. Neuro is nerve. Ophthalmo is eye. So if you go to an ophthalmologist, that is an eye doctor. As opposed to an optometrist is a person who is a medical professional and they help get you glasses and contacts. They're a little different. If you need surgery on your eye, you go to an ophthalmologist. If you need glasses or contacts or minor problems with your eye, you go to an optometrist. O is ear. We talked about that one on day one. We talked about an otorhinolaryngologist. Patho, we discussed earlier, means disease. So if you're a pathologist, you're one who's studying diseases. And you see a lot of people who are doing pathology and stuff with the COVID outbreak. They're studying that. We've also talked about pulmono and rhino, and uro means urine. All right, we have plenty more combining forms of words that we're going to talk about this semester, but here's just a couple of lists of ones that we are going to talk about throughout the whole semester. So that's what we got. I will see you guys next time.